Hey guys, Dr. Amy here with Fortress Physical Therapy. Today we're going to demo a little bit of scraping, or what I like to call IASTM. So IASTM just stands for Instrument Assisted Soft Tissue Mobilization. So we use tools, as you can see, different contoured tools. This is actually a piece of metal and a nice contoured edge coming up here, down here, that kind of resembles almost like the handle of a butter knife. I have some other ones here too that I'll show you. This one's a little bit bigger aspect. This one looks like a little fan. And today we're going to use my Bob Ross tool. I like the end of this, especially on the elbow aspect. So today we're going to demonstrate on my athlete Whitney here just what the concept of IASTM is and when I would apply this. So as you can see, I already have some of like a lotion barrier. You definitely need some type of lotion that the patient isn't allergic to. So I typically use cocoa butter. I like it. It smells good, and it's just a great barrier. But finding any type of lotion that's a little bit more oily based will definitely help when you use instrument tools to help break up some scar tissue adhesion, etc. So usually I'll have the barrier already on, and I'll just kind of spread it out first, just to kind of blend things in a little bit. But usually when I do scraping with my tools, I usually perform it when someone is going through a bout of like tendonitis. So a lot of us may perhaps get some elbow tendonitis or Achilles tendonitis. This is great to bust out these tools in order to help heat up that area and push in more good inflammation into that area. So I'll kind of do some broad strokes first. And as I'm going through the broad strokes, I'm feeling through the tool any of this like kind of gristliness sensation. Now, I'm not just going to keep stroking downwards onto the tissue, but I'm also going to go different ways. Now, why? Like, how do I know where to concentrate? Well, it definitely always comes back to the patient anatomy and what they're experiencing. So you have to know that as a clinician. Fortunately, but unfortunately, I've suffered a bout of elbow tendonitis, so I know what this feels like. Now here, I can feel some gristliness there. Whitney can too. So I'm just like focalizing the area more and more and more. And then I can kind of like almost kind of dig in there and a little bit probably feel it's already getting a little bit warm. Whitney probably feels it getting a little bit warm too. But this is great, you know. Say I might utilize this perhaps before stretching out the elbow in particular, where I get that tissue nice and warmed up, a little bit more pliable, and then I hone in and start stretching the joint a little bit more. So this is just a nice, great tool in our toolkit, no pun intended, to use. Especially, I specifically use when patients experience a bout of tendonitis that's going on. It feels good. It's not painful. It might be a little annoying on the end right here. But I can also flip the side, right? So I can come in like this and go this way, you know? Just get a little bit into this bicep here. So that's just something in our toolkit that I like to apply to patients, and not only does it save my hand instead of digging in there and massaging it, right? Because I have another patient that's rolling in. So the tool does most of the work, and I'm able to kind of focalize it more and more. And kind of makes the patient feel a little good, and it can be sore at times. It depends on the symptoms that the patient's experiencing, but yeah, so that's kind of how I incorporate some of this IASTM technique.